Health insurance exchanges are a vital part of the Affordable Care Act. So let's take a look at exchanges, what they are, and exactly how they work. First of all, there's two of them. One is called the American Health Benefit Exchange, and that's for individuals, and that's where all the government subsidies will be administered through. The second one is called the SHOP Exchange, and that's primarily for smaller employers. Now, to understand the American Health Benefit Exchange, let's first look at the market as it is now. You've got individual people looking for insurance and carriers in the market who offer insurance to those individual people. And that person, by working with an agent or a broker, maybe going online, maybe talking to Ann Helen, decides which of those carriers is the best fit for him or her and enrolls directly with the carrier. And then all the transactions, all the billing and payments directly between the carrier and the individual person. The exchange is going to do it a little bit differently. The plan selection and enrollment will actually go through the exchange, and there'll be tools on the exchange through their web portal that will help guide people to the plan that is the best fit, using quality ratings and using price and the benefits covered in the provider network. And the individual will also, as part of that process, provide information to determine if they may be eligible for a subsidy through the exchange or if they may be eligible for other governmental programs. And the idea that there's no wrong door is a part of this whole idea. So if someone goes to Medicaid, the Medicaid office can decide, no, you're a better fit for the exchange. Or if they go to the exchange, they may determine part of your family or all of your family is a better fit for Medicaid or CHIP. Let's assume this individual person we're talking about enrolls through the exchange. And so their information and the information from all the other individuals enrolling will be sent to the appropriate carrier, so they'll know they're actually a part of their population. And they'll also get the information about the subsidy if they qualify for a subsidy. Now, in the ideal world, the exchange then would begin billing the individual person, and that payment from the person, their portion of it, because they would only pay the portion they're responsible for, the non-subsidized portion would be then paid to the exchange. The second tier of all this is the exchange would pay that premium to the carrier, and they'd notify Uncle Sam of their responsibility for providing the subsidy portion of the premium directly to the carrier. And finally, there's a concept called risk adjustment. And that means if Carrier C, for example, got a higher risk profile than Carrier A, there would be an adjustment of dollars to make sure no carrier had an undue burden within the exchange. And the last piece is reconciliation, which is simply keeping all of these parts and pieces in sync and making sure all the dollars and payments balance every month to the penny. And that's the American Health Benefit Exchange.